I love music. I like to sing. I sing in the choir. I am a member of Church of Pentecost in Albany, and I like to dance. So that's my stress relief.
Thank you so much. We appreciate you for taking time to actually join us today in the chat room to be a blessing to many that are out there. I'm still working on the link, so be patient with me. I think our technical difficulties just kind of threw me off. I forgot to set it up. All right. So today we are looking at a topic which I believe everyone. Nanaya, should I take over or you want to take over? Should I go ahead? Go ahead. Okay. We're looking at a topic that is really important. Okay. Women's health this month. This is for postpartum depression, and a lot of women deal with this. I think sometimes if you're not careful, you might not even realize that you're dealing with it. So we will allow Miss Linda to just take the floor, and we have our own questions we're going to ask, and then as the our audience also bring about their question, we will let you know, and then you take it from there. Would you want the slides now or later?
You can put it up. I have it here as well, so I'll just follow however you
Okay.
started.
Okay. Is that a slide? Is that one?
Yes, that's the one.
Okay.
Beautiful. So I for today, like Lady Mary said, I wanted us to focus on mental health in women, and with that being said, stress and postpartum depression. Depression in general, postpartum depression specifically, which I believe with our audiences is something that is very, very common, but the least spoken about. So I had a quick agenda, but I know this is a discussion, so I'm not gonna make it very classroomy. I don't want to be lecturing. I want us to have an interaction. So if you have questions, if you have a suggestion, if you have something that you want to add on as I'm speaking, please go ahead and do so. But I wanted to start off with what is stress? What do you understand when somebody says they are stressed?
Hmm.
Um, Anybody can jump in and tell me what they know about stress or what they believe stress is. All right, so I'll go
Oh, this
ahead.
is this is for us.
Yes, it's for
Okay.
anyone. I want us to have a chit chat.
Okay. Um, Stress, I guess to my understanding, it's I guess it goes hand in hand with worrying. Um, what is stress? That's a good question because I feel like I can't define stress without using the word stress.
Well, you
But
did
it's
a good
more
job
like,
saying worrying,
yeah,
right?
it's more like worrying, just mental. Um, I was gonna say mental stress, but you can't define
It's
stress as
it's
stress.
it's
But
worrying. It's a state of worry or mental
yeah,
tension. So you said it. You got everything
okay.
right. You get
You
A
said a
plus
state
for
of
that.
worry or mental tension.
Yes. Which
Okay,
is caused by a
mental.
difficult situation, right? So it could be anything. If you're worrying about your children, you're worrying about your education if you're in school, if you're worrying about your married or not, if you're worrying about work and finances, those are all things that can cause you stress.
Mhm.
So it's a state of mental tension. You feel like you're on edge, right? And we say stress and we say anxiety in two different ways, and it's only due to the timeline. Okay. So if you sit in stress for too long, especially if you've been stressing about something or everything in general, we call it general anxiety disorder. If you're worrying about a lot of things for a long period of time, now after 6 months, and you come and see a specialist like myself, then we can say that this person has anxiety, generalized anxiety disorder, social anxiety. There are different types of anxiety and stress. Some people just get stressed, when they start talking in public. Like right now, I have a little bit of stress because I'm tensed, right? I want to make sure that my information, whatever that I'm saying, comes across the way that it will be perceived, in a way that it will impact people. So you don't want to make a joke of yourself, or you don't want to make a mistake. And these are little things that can make us stress. Some people, you tell them to, let's say when I was in school, they say you have a presentation or you have a test, and people can literally go into like GI symptoms when they start having diarrhea. There was, some people will get very nauseated when they are in high state of stress. So
Mm.
that's basically what stress is. Um, we can go to the next slide and the next one. Perfect. So the next one, please. To slide number 4, which is what I just discussed about. So a state of worry or mental tension caused by a difficult situation. Now, when we say stress, it's a body's way of promoting us to address challenges. It's our body's way of warning us that something is wrong. It's our body's way of actually protecting us. So a bit of stress is actually what God made us in a way to warn us, our body warning us that, hey, you gotta pause and take a look at this, because if not, it can cause harm. We have short-term benefits of stress. Like I said, it helps you raise to challenges, a little bit of anxiety to make you maybe sit up and read that test that you need to study for so you can pass, or set goals for yourself, or meet deadlines. Or it also strengthens our stamina and also concentration. When we are stressed, our fight or flight system is activated, which means that your body, even your eyes would get dilated. It's a way for God made the body that way. So you can actually see that danger that is coming. Your body is telling you that there's danger. Maybe it might not be anything dangerous at all, but that's the way the body is telling you there's something that is worrisome that you need to be paying more attention to. All right. So then we have um types of stress. We have the physiological ones. We have the stress also affecting our immune system. When you are in high risk or you're in high stress, it can affect almost every part of your body, your heart, your digestive system, your immune system, your musculoskeletal, your endocrine, and even your reproductive. And so, with us women, sometimes, when people are very stressed, they actually will not be having any menstrual cycles at all. Your body will shut down that way. That is affecting your reproductive system. And sometimes some people who are like in childbearing ages and they are stressing themselves, or they're like trying so hard to have babies, and because of that they are doing everything, and out of that stress, it can actually, prolong you having a baby. So as much as we want to have this baby, our body is in so much tension that we are not able to produce. Cardiac wise, hypertension, we all know, hey, my so stressed, I feel quite many hypertension, many have high blood pressure, right? We say that all the time. And it is true. The blood pressure will rise because of the stress that you are in. And if you stay like that for a long period of time, it causes a lot of problems. The stress can also increase your cortisol level, and also your glucose level. So it doesn't cause diabetes, but it will increase your risk of getting one. Please stop me if you have any questions at all.
So, well, I want to ask a quick question, quick one.
Yes.
It could be that it's not related, but what happens when you begin seeing your menstrual cycle like twice a month?
Okay.
Is
And
that
that is
also
not
related to
normal.
stress?
That's not your baseline.
Okay. No, 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 not for me. I mean, I have like people that express these concerns, like, why am I seeing my period twice? And then the least I could do is go and see your doctor. But I guess
Yes.
it would be good for me to know, for myself, because I have girls, right?
Yes. So With my daughters, like what my oldest one is 13, when she had her period a year ago. When they start their period like that, the body is not still it's not a routine yet. So the body is still trying to figure out, right? So that's not going to be consistent. I tell her to write down. They actually have an app on her phone that tracks her period time. So there are some months that she can have it twice. There was a month that she didn't have anything at all. It's still the body trying to adapt. But if you are an adult like myself who knows their pattern of menstruation, for me, I don't want to over disclose, but every 27 days I have my period, right? So if that's what my baseline is, and then for like 2 months I've seen my period 2 3 times, the first thing I'm going to do is really figure out, am I in high tension? Because there was a period not too long ago, I did forget to tell you guys that I also own my own private practice. And while I was building that app, I was so stressed that I was having my period every 2 weeks. And I was like, what's going on? But the moment that I calmed down and I felt like things are in place, it went back to the way it was. So me as a nurse, I would say monitor it for like a couple of months, but if it doesn't go back to how it is, you need to see your GYN. Might be something wrong. There might be nothing at all. I know there are other medical conditions that can also interrupt your menstrual cycles, and stress is one of them. But also is PCOS or fibroids and stuff like that. So if all in doubt, please see your GYN, your primary doctor. And if you do not have a GYN, please get one. Thank you. Please, did I answer your question?
Yes, it does. Thank you.
Perfect. So, like I said, when you go to slide 14, it tells you a little bit about the reproductive system. Women sometimes will have irregular cycle or painful or absent menstruation, like I said. For men, it will affect their testosterone level and reproductive function. So you and your partner both are stressed because you're trying to have a baby. That can actually prevent you guys from having babies or prolong the process of you conceiving. And so the first thing that you really want to identify is what drives your stress. What is causing you that stress? What's causing you that anxiety? Is it your relationship or lack thereof? Is it your family or your children? We women, especially African women, especially me coming from Ghana, sometimes we carry so much responsibilities here in America and back home in Ghana. And so that could be one of your stress factors, right? Like I said, work or education. So we need to, first of all, for you to be able to solve or for you to be able to get yourself relief of that stress, you need to identify what is causing that stress. All right, so our next slide, we are going to jump into depression. What is depression? Um, is it something that we just make up because it's like the word in fashion these days, or is it something that is real? It is real, just like stress and anxiety is. All right. So when we say major depressive depression is a medical condition that distinguishes one by a more major depressive episodes. So a major depressive episode is characterized by at least 2 weeks of feeling very depressed or loss of interest or pleasure in doing things. We call that anhedonia, right? So if you are someone like me, like when I was introducing myself, I told you guys I love music, I love to dance. If you see me now dancing when there's music going on, or you see me with no music and I'm sitting there and I'm quiet, there's something going on. Or the music is playing, but I have no interest. There are things that you love to do. Let's say you love to maybe go out with your friends. Let's say you love watching TV. If you're depressed, that you will lose that desire to even do anything. And it's characterized by at least 2 weeks of you being in that state. And it's also accompanied by other symptoms that I will talk to you about. we need to be aware that women have a higher risk of depression compared to men, so 6 to 4. And according to research, Christian women, Christian females are the hardest to minister to and the hardest to treat because of certain factors that comes into play with us being religious women, with us being prayerful women. Sometimes it's actually we are actually the hardest to get help. We are the hardest to treat. Um, if you have a question, please you can jump in at any time and I will stop.
So you said Christian women are the hardest to treat.
Yes.
Um, and you think the reason why is because of our belief?
Not necessarily. Our belief is actually a protective factor. Where
Mm.
we jump into suicide and suicide risk. Somebody or any person who has a religious belief is a protective factor in them not harming themselves. However, the guilt that sometimes comes with us being Christians and being depressed, you start to question maybe you did something wrong. And maybe you might not be the one questioning yourself. It may be somebody outside telling you, oh, maybe you did something wrong. God is punishing you. Maybe you need to pray more or pay your tithes more or do something more. It makes you feel like you are not a good Christian. So if you were, why are you depressed? If you were, why is God not relieving you of those of depression or the anxiety? Did I
So
answer
what
your
would you
question?
yes, but what would you say um is the, I guess, the treatment for that? You know, because
So
we're
yes,
relying on the thinking that we're depressed because we did something wrong,
yes,
right?
and that is never the case, right? So your belief again should be a protective factor. God said, the Bible said that He did not give us a spirit of fear,
Mm,
but of understanding and of sound mind, right? So that right there is telling you that God knows that there will be times where we are down. There is as a PowerPoint slide that I did a presentation not too long ago, and I went into details about the prophets in the Bible that went through anxiety and depression. So just because you are you are a Christian woman or a Christian mother and you are depressed doesn't mean that you have done something wrong to God or God is punishing you for something. Even in the Bible, Job, in the Bible, Jonah, in the Bible, Abraham, most of these prophets actually went through depression to a point where Moses actually told God to take his life. He does not want to live anymore. And God was like, are you sure you're supposed to say that? So we need to understand that whatever that we are going through, it's not a punishment. It's not because we did something wrong. It's not because, maybe we did not tithe or some sins that you did in the past is now coming back to haunt you. So you should sit in that depression that you deserve that punishment, and guilt and shame is one of the hardest things to treat when it comes to depression. If somebody comes into my office and and we did all the assessment and we did all the evaluation and I say, hey, I believe that where we are right now, we need to start you on medication. You can give them all the medication in the world. If that person have that guilt and that shame, and sometimes they believe that they don't deserve relief, the medication is not going to touch them. So, and always I tell my patient, if you are a believer, guilt and shame is not of God. If the devil is trying to turn your eyes against God, they will make you feel shame. They will tell you, so you don't deserve God's grace, you don't deserve God's forgiveness. And sometimes we are the hardest on ourselves. So these are things that actually will drive your depression more. But we need to understand that God is love. And in the Bible, he says that do not be anxious for anything, right? But with everything, with prayers and supplication, that right there is our remedy. He's telling us to come to him. He's telling us to supply, is like supplement to supplication is basically like just letting it all out, laying it prostrate under God's feet and saying, God, I cannot do this. I need you to take control. So that right there is our protection. So that's why I said it's a protective factor, but sometimes it becomes actually a barrier for Christian women to seek help when they are
Yeah,
depressed or anxious.
Yeah.
yeah. So
I
they
I
are.
okay. No, no, go
Go
ahead.
ahead.
No, no, you go ahead.
So, um, based on that scripture, that you referenced, that in everything, you know, bring your
Prayer
supplications
and
and your
supplication.
prayers to me.
Mm-hmm.
So, in a way, um, we find that basically we need to go. We translate that literally,
Yes.
right? And say, okay,
Yes.
I'm going to go to God and pray about it. But
Yes.
sometimes you're in the mental situation that you may be in,
You will not feel
you
like
might not
praying.
be like, even though you're praying, right? Mentally, because when you're praying, right, you have to
Mm-hmm.
also be in the right mental space to receive whatever it is that you're praying for, right? But
Yeah.
sometimes in that depression, you're so um locked in that you can't even release your your mind to receive that healing,
Right.
right?
Mm-hmm.
And I think that's when um people like you, doctors, psychologists, mental health counselors, and those people come in. But
Yes.
because of our religion, which you're saying is a protective factor, can we say that that can also be um,
A burial.
like a detriment,
Yeah.
because
Yes.
we're so focused on that and not going out, right? We
You're
refuse
right.
to think that there's anybody else that can, like, God cannot use anybody else to help us. It has to literally come from heaven and fall on us.
It is not going to. Unfortunately, he's not. And you said it very right. That's what makes it a bit harder. That is a barrier because it's like pray more, do even more. Some of them will actually come and see you and they will tell you that I don't want any medication. We've done the therapy, we've done all of that stuff, we've done a lot of praying and fasting, but you might give them medication and they will not even touch it, right? And so what I would say is just the same way that you treat your hypertension, just the same way that you treat your high cholesterol, that's the same way that you take your diabetic medication, be it metformin or insulin. That's the same way that you can take medication for the anxiety if it's needed. Okay. Before I will prescribe any medication to any person, I've actually asked you to do some therapy. They teach you some coping mechanisms to use. And when you come back and I say, have you tried all of this? And you say yes, and you're still going through this and it's becoming a problem. Now, we only treat when it becomes a problem to your daily functioning.
Functioning.
Okay. So, like Nanaya really rightfully said, when people are depressed, they get to a point where they don't even want to get out of bed. There's low motivation. There is a lack of pleasure. There is low energy. They don't want to eat or they eat a lot. They sleep a lot or they don't sleep at all. So you lose any desire. I have seen patients who have gone for months without taking a shower because they are depressed. They won't even brush their teeth because they are depressed. So how then do you ask this person to go and pray? They don't have the desire or the energy
Don't
to
have the
even
capacity.
pray.
Mm-hmm.
And that's where we come in. That's where you needing what do you call it? Like a network of women, a network
Mm-hmm.
of people that you trust to
Yeah.
then intercede for you. because sometimes you really cannot do that prayer yourself. You
Mm-hmm.
might be praying, but your mind is not even there. I
Mm-hmm.
have a patient coming, it's like, I start praying, and then within a minute, I forget what I'm even praying about.
Mm.
So I feel like we've gotten to a society where we kind of like are so prideful about me there. Me there, I don't need anybody. And now for 4 days, they will do this, they will do that. I don't trust nobody. It's just, yes, people will hurt you. Yes, you cannot rely on people, but you should be able to find 1 or 2 people who
Mm-hmm.
will be in your corner at all times, who will never judge you, who you can go to when you are in dire need of somebody to talk to. Because when you are depressed, and you
Mm-hmm.
are sitting there in that misery and in that dark space in your mind, you are surrounded by people, but you still feel alone. Those are the people that you want to call and be like, or you sometimes you don't even need to call them because they know you. They can feel that there's something wrong. They will call you on the phone and be like, I feel there's something off of you. They will ask you what's going on. You might talk to them about it, or you might not. But those are the people that will just pray for you without you even asking.
Mm.
And that's very important.
I was gonna say that, speaking of God, I believe that the Bible even talks so much on we praying and not receiving, not because we pray amiss. And you know, sometimes we live in so much denial.
Yes.
Honestly, I think Christians are have so much advantage, but we read the word of God, but we lack understanding. It says lack of knowledge, my people perish. We lack understanding. So just because I'm not, and if you know me, I can never be against prayer or spirituality and all that because of where I'm coming from. But read, it says that in all thy gettings get understanding. And
Yes.
so we I think my husband said something yesterday that false teachers are the most dangerous. People often blame prophets and things like that, but false teachers are the most dangerous because they can teach you something, and if you are not careful, remember
Mm.
the word of God is a seed, and once that seed grab hold of you, and you yourself don't have the wisdom or the brains to go back to this same God, okay, to inquire for yourself, you would be falling into a pit that I don't know what it would take to really bring you out of that pit. I say all this to say that please, in all thy gettings, get understanding. There's a reason why God will give someone the wisdom to become a nurse practitioner, a counselor, a doctor, a pharmacist, a human service practitioner, an IT person, and this and that, someone in HR. There
Mm.
is a reason why God has given people the knowledge and the wisdom to go to school to get into these positions to be able to help us. So, common example, last month we talked about autism. If you are picking certain signs from your child, and you know yourself that according to the milestone of newborns, something is missing, pray, and after you pray you act. Bible says prayer without works is dead.
Right.
So after you've prayed, take that child, schedule an appointment with your pediatric, with your, what is it, pediatrician,
Pediatric.
right?
Pediatrician.
Yes,
Mm-hmm.
and go and seek help. Sit down, have conversation, allow God to do his part. But you too, you have a responsibility. You're not going to leave all your responsibility on God. No.
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 It's just like someone who says, I'm looking for a job, and they've prayed, they stay in the room 24/7 and
In
pray
your
and pray
home,
and
no
pray.
application.
You've not put in any application, you've not built your resume, nothing. You're not even taking any course or whatever to develop yourself or to prepare yourself. You're not watching interviews, nothing. It's
No.
not gonna happen. So I say all this to add to what what Miss Linda and one and I are saying. Please, in all thy gettings, I beg that you would get understanding. Thank you. Please take over.
Thank you so much for that. I actually forgot to add that to what I was going to say. Is that sometimes the churches, the leaders of the church, are also a hindrance in people seeking help. Diana, don't you believe in God? But yes, we've done all of that. We are still praying, but this person needs to get a specialty treatment,
Counseling. Hmm.
and they just will guilt trip you into going to seek help, and so then you sit in that misery. And I'm not sure if it's just me, but I hear so many suicide stories these days, more than it used to be. Why is that? Because people sit in their misery and they don't seek help, because they make us feel like you seeking help, you going to see a therapist, you going to see a psychiatrist, you being on medication is such a bad thing because you don't believe in God. We do believe in God, but yet we go and get surgeries for our heart if you need a heart surgery. So why then do we make it such a bad thing when it comes to mental health? We need to educate ourselves, and also maybe have more people in authority be more aware and knowledgeable of these things that's going on, that is hurting as women, so that they can also give the right teachings for us. Anybody have any other questions?
Yeah, and I wanted to add that, the read this comment by Kabna Sapon, saying the disciple of Jesus, Luke, was a doctor, and also the balm of Gilead in the Old Testament. And also, I mean, the Bible itself says seek the safety in counseling.
Yes.
There's safety in counseling. So, like lady was saying, we pick and choose what we want to take and what we want to leave out, because
Mhm.
literally everything that we do, if you want to find it in the Bible, is there. But we refuse
Yeah.
to look at that because we are holier than thou. And if the miracle doesn't fall from heaven, then we don't want it. So
Yeah.
my people perish because of knowledge,
Right.
lack of knowledge. Yeah.
And being each other's keeper, right? So sometimes some people might not even be aware that they are depressed, but their actions and their way of doing things, if you are the person that's close to them, bring the attention to it. Is everything okay? Because sometimes the mind has a way of protecting us by making us forgetful of things that hurts us. So within you, you subconsciously, you are very anxious, you're very depressed, but they come to church or they come to functions with smiles on their face and everything, but you know that they are hurting. And those can also be very, very dangerous, because then we put on that mask, and then when we go home and we take it off, and sometimes they'll be in bed with their husband don't even know that they are depressed,
That
or
part.
that, yes.
Let's focus on that part.
No, no, hold on. Please, before we continue, if you are just joining us, if you're on Facebook or YouTube, this is the chat room, a platform dedicated to resolving daily life issues. It's our hope to bring about transformation to you and ours as well. The type of discussions we have here, very interactive, educative, and informative, just as you are listening on to now. Please, if you're just joining us, just kindly do us a favor and just click the share button and share it to someone that so that they can also benefit from our session tonight. Nanaya, go ahead.
Okay, so let's focus a little bit on that part, because if somebody, if you live with someone, right,
Right.
and the person is behaving, that you can actually see that what their behavior is out of norm,
Mm-hmm.
right? They are quiet, they are distant, um they just, it seems like there's a cloud over their heads.
Right.
They they're not the same. You can clearly tell that they are depressed, right?
Mm-hmm.
Especially in those postpartum um times,
Depression. Yeah.
right? So somebody
Mm-hmm.
just had a baby, you can tell that they're just not the same. And I'm speaking to husbands now,
Mm.
okay? I was listening to a sister of mine who had lost family members and was deeply depressed. It's hard to communicate the fact that you're even in that position. Okay.
Mm-hmm.
So she communicated this with her husband. And she said, like literally, she's at the point where she's so depressed that she feels suicidal.
Mm.
When she communicated this with the husband said, you know, na me unim enyama mi kum. Do you know what I'm going through?
Yeah.
Me too, I have problems. Why do you want to kill yourself? Because me, the problems that I have, you don't think that sometimes it's too much for me, you know? And you're talking about killing yourself. I was like, excuse me? But
Yeah.
that's our people. That's like, to me, it's not out of norm. Like, it's not something that I'm kind of like, oh wow, I can see that happening.
Right.
But can we do better, please? Can we do better? For someone to come out of the mouth and tell you that they are at this point,
Yeah.
it took a lot from them to come to you, right? But for
Yeah.
you to say, do you know what I'm going through as a husband, as a partner, as a spouse, as someone who's supposed to be a protector for
Right.
this person, right? And then you come home tomorrow and they've overdosed and killed themselves. Then what?
Mm-hmm.
Yeah.
Then
I
what? So we have to be very careful in this age that we're in. We know so much. We're learning so much. We're learning so much. When we didn't know, we can blame it on not knowing. But in this age, we know. And I mean, for someone that you claim to love, to tell you that, or even for you to see that they are going through that and you just ignore it and do nothing about it. To me, that's not love. That's not caring. And that's not Christ-like.
Right.
Because we want to, put everything on, I'm a believer, God will do it. I'm this, God will do this, and that, But then
Right.
we sit over there. That is not God-like. And that is not husbandly or, it's not love. It's not
So
love. So let's do better.
yes, and in all fairness too, sometimes I think culture has a big part to play in it
Huge.
because we we
Huge.
we tend to be like, oh, snap out of it. Wait, everybody go through this. You'll be okay. And so we minimize how the person is feeling. Yes, you might also be going through that, but you are not at that stage where they are suicidal, or
But it's not about you. It's not about
no.
you.
But that's what our culture and society sometimes does that, right? Like let's ignore it. So
Hmm.
so let's not pay attention to it, or
And it will
then
go
maybe
away.
obey. Yeah,
Yes.
we
Listen.
like
People
no.
are dying here. People are
Yes.
killing themselves.
Yeah.
And we're like,
So
oh, we don't know what happened. They were
yeah.
fine. This and that. Depression kills.
Yes.
It kills.
Yes. I
I
wanna.
Miss Linda. So
Yes, ma'am.
before you move on to your next one, you're talking about spouses, even our children. You know, with experiences, sometimes when your child tells you they're stressed, I mean, the first thing is you don't pay bills.
Yeah.
You don't pay bills, but no, truly, and I'm glad you are the right person to talk about this. We will tell you don't pay bills. You're just going to school. You don't buy anything. You're
Why are you
being
stressed?
fed.
You have no problem.
All that everything is being provided. So what makes you stressed? You cannot be stressed. But we need, instead of, I guess there's a word for it. Is it motivational interview type of thing? Ways
Yes.
to change, how we say things.
Yeah.
Okay. Because sometimes the response we even give, it makes it worse. So
Yeah.
I know you guys were talking about husband and wives and all that, but even the children that are in our home,
Yeah.
maybe a niece or nephew can come to you and say, I'm stressed. Like, why are you stressed? When the moment you say that, and I feel like that's why sometimes a lot of our children are not comfortable in talking to us.
They're
They want
not.
to go to the outsider
Mhm.
because if I come to you, you're going to think I don't pay bills, so I should not be
Yeah.
stressed.
Yeah.
but peer pressure is out there. Influence, external influences. Children see things. There are certain things
Yes.
that children are not allowed to do in our home, but they're seeing other people, children, other children are doing it. So it's all about communication and finding the right words, to say or to use when it comes to these things. But go ahead, please.
Yes, yes. Me being a mother of two, and my kids are still very young. That's is it can be very tricky, and sometimes I actually have to take a step back because my initial response is that of a Ghanaian mother.
Mm-hmm.
But you are lucky if your child actually comes to you and say, "I'm stressed." Most times they don't say anything. Most time they don't even know that they are stressed,
They just
but they
hold
are
it in.
coming home. Yes.
Mm-hmm.
So that means that you actually have built an environment where your child feels comfortable enough to come to you and say, "Mommy, I'm stressed." And so please, even no matter what it is, take a step back and tell me more. What's going on? Did something happen? Do you want to talk about it? Um, I've gotten to a point where I tell my kids, I will give you the permission to talk to me about anything. And you can tell me, "Mommy, I don't want advice. I just want to talk." Because
Mm-hmm.
sometimes they just want to talk.
They
They
just
don't
want to
want
vent.
you to come
Yeah.
and give them the holier than
Solution.
thou
Yeah.
advice,
Mm-hmm.
right? Because I see this also a lot in our churches where the youth are going through so much and yet their parents have no idea because they'll come to you and talk to you about it. I'm like, talk to your mom. No, when I talk to her, she's just gonna yell at me and she's gonna judge me. And so they keep it in. And
Mm.
that's why suicide rate in those ages are also on the rise.
Yeah.
Lady
Yeah.
Mary said it rightfully. Our kids are going through so many things that we did not have to go through. I don't know
We
how
did.
old, maybe I'm aging myself here,
Mm-hmm.
okay? But the internet and the cell
It's a
phones and the
different ball game. It's
tablets
a
and
different environment.
all these things,
Yeah.
right? And you get bullied when you go to school and when you come back home, you are safe. But now you get bullied in school and it follows you right to your child's
Online. Yes.
bedroom.
Yes.
They are online. They are
Yeah.
telling your kids to go kill themselves. So
Mm-hmm.
please, I'm begging you, first of all, create an environment where your children are comfortable to come to you and talk to you. Listen, if you want to judge, when they go to their room, you can judge all you want and you can scream to yourself all you want. But when they come to you, please listen and in all fairness, give them the best advice that you can. Let them know that no matter what, you are always going to be there. Let them know that you are not going to judge them because if you shut them down, next time they're going to talk to a friend and the friend is going to tell them, "Oh, I've been through this before and you know what I did? Like, let me just give you a little bit of weed. Let me just give you a little, like I took a little bit of my dad's alcohol and I
And I
slept
was
like a
fine.
baby."
Yeah. Yeah.
Right there, that's the influence.
Yeah. 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 And then
So,
sometimes too,
yes,
it's okay to not have the answers, right? In some serious situations, you might not know what to say. You might not know what to do. That's why there are professionals. You know, I don't see a whole lot of us saying that my child seems to be stressed more than usual or going through something that I cannot help with.
right.
Let me find a therapist. Let me find a counselor. Let me find somebody in the church that will be able
Yeah.
to, we want to just keep everything secret. We don't want to, like, we don't want the next person to see what's going on.
Yeah,
But is it worth your
it's
child,
not.
hurting
It's
themselves?
not. And
Is it worth it?
there was a situation that the child actually got in trouble because they asked for help from someone else.
Mm,
Because we keep everything in the family. How dare you now, like the whatever it is that we wanted to portray out there in the community is all shattered because you went and said that you were depressed and you wanted to harm yourself. Now
mhm.
they're gonna say that we are bad parents. So you are not, I'm not going to judge a parent. Maybe you tried and it's still not enough for the child and they want to talk to someone else.
Mm-hmm.
Seek a professional. But if they talk to someone and you shut them down, next time they're going to keep it in. Next time they're going to talk to somebody else. A
You
child
didn't talk
came
to a
to,
friend.
yes,
Mm-hmm.
one of my patient came to me, and he had been cutting
Oh.
and started weed and alcohol at the age of 13, and the parents had no idea. And I
Mm.
asked, what made you do that? It's like, well, I had some girlfriends who were doing it.
Mm.
And so they told me that it makes them feel better. It takes away that emotional stress, and it becomes more physical. So they start doing that. So again, being there, present, being available, and seeking help is very, very, very important. If you do not go to the right person, you're just going to make the case even worse for yourself. And so then, for us, how do we know what depression looks like? How do we know what are the signs and symptoms to look out for yourself, for your loved ones, for your kids? What are some of the things that you should be looking for to say, maybe this person is going through that, or maybe I'm going through that? Okay. So if you are an adult, sometimes you feel yourself very tensed, right? Like everything is like you feel like something bad is going to happen. That kind of like on your shoulder, checking over your shoulder all the time. You're worrying a lot. You are irritable. Adeɛ kakra bi na wo bo afu. Every little thing will set you off. Somebody will breathe and you're like, why are you breathing so hard? Oh, woe betide your husband to even chew too loud in your face. They're gonna be in trouble. But that's maybe not your norm, right? Like I said, loss of interest, trouble sleeping or not sleeping at all. Some people are hyper like awake in the morning, hyper awake at night, or they will sleep, or they will sleep the whole day. They will sleep through the night and through the day, and they don't want to get up. Fatigue. They can sleep all that time and they wake up and they are still very exhausted. Or again, loss of energy, right? Difficulty bonding with your baby if you've had a baby. Like that's where we branch into the postpartum depression. Okay. And it's not just postpartum, we actually have peripartum, where when the woman is pregnant too, that they have a high risk of also developing some form of mental health depression. Peripartum, postpartum. And these are things that you might want to just take a step back if you're feeling like that. Like, why am I so like upset all the time? Why am I so like just like on edge? Oh, like nobody wants to approach you because you are giving off this like high tensed energy. If you're looking at your child, if the baby, if they are old enough to communicate, but they are not really communicating, there are symptoms that you can tell. Again, being overly cryful, like they're just tearful all the time. They come from school or they are home, a kid that is very joyous and bubbly, all of a sudden you say, oh, go put your bag away, and they start crying for no reason. They get very irritable. They are not consolable. If they start crying, you can't even console them. Um, if they are again very energetic and you see them in a corner somewhere all the time in their room, now they don't even want to come out of their room to come and eat, that's a problem. If they are complaining, sometimes abdominal pain and headache is one of the biggest things that the kids will say. Oh, I have a belly ache. Oh, my head hurts all the time. What time do they do that? Is it before they go to school? Is it after they come back from school? Is it when they are home? What is going on? Who are their friends? Are they being bullied? So if you see changes in your kids like that, start asking questions. Start being a little bit nosy. What's going on? Hey, you want to talk to me about it? Don't force it. If they don't want to talk about it, just let them know that whenever you're ready, I'm here. Okay. Also, I just lost my train of thought. Some of the kids that are not old enough, maybe they are 2, 3 years old, but they don't wet the bed anymore. All of a sudden, they are wetting the bed. You go and get them, and like, oh, you peed again. Oh, mommy, I didn't even know. They are stressed and they don't even know it. They don't know how to communicate, and so the body has a way of communicating with you as a parent. Watch your kids, please.
So with
um
the postpartum depression part, right?
yes.
what is causing that? Is it
Yes.
separation? Is it hormones? Is it like, because I mean it's real,
Yes.
but I think it took
So,
a long time for us to um kind of get with the program to know that it's real, because
or even acknowledge it,
to
right?
acknowledge that it's real. Yeah.
Yes. Lady Mary, if you can go to slide 20, just so they can have something to visualize while I'm talking. So, causes and risk factors for postpartum depression. It says that there's no single cause or factor, but there are different things that will increase your risk of getting postpartum depression. One of them is the hormonal changes after birth, history of depression or anxiety. If you have history of that, or you were even depressed or anxious when you were pregnant or before you were pregnant, you have a high risk of that. Sleep deprivation, which is one of the biggest. The baby is not sleeping, you are tired, you are not sleeping, that can increase your risk of also getting postpartum depression. Stress and lack of support, especially here in America. Like I always say, I remember when I was like a kid, you come back from school, if somebody has had a baby in the house, that's the best time to come back from school in the afternoon, because you come back and there's fufu bidi and ben kwai bi is waiting for you. The community is around you. Your mom is there. Everybody is taking care of you. But you are here in America. You have a baby. It's just you, your husband, and the baby. If you're lucky and you're able to bring your mom from Ghana, or your mom is here, great. But if your mom is here and your mom is also a working woman like ourselves, they don't have time to sit in with you, right? So the lack of support and the stress that comes with raising a child can really increase your risk of also getting postpartum depression. If you had complications during your pregnancy or complication during the delivery, and also major life changes or trauma. Did you lose a friend? Did you lose a parent? Did you lose a loved one? Trauma. Things happen as accidents, something like that, that has already been in the past, in your past, and you have a baby, and then these hormonal changes all comes in, that can increase your risk. And you can tell me, you can see that I'm saying increase your risk, because so I don't want to say that's what causes postpartum, because there are different things that comes into play, and they all add up for you to do that. So we need to understand that postpartum depression is not a personal failure. It doesn't mean that you are just not a good mother. It doesn't mean that all these women have had babies, they didn't go through depression. All of a sudden, you're telling me you're depressed? Please, what so be nice. Sorry, Neko page and be what do you mean say you are depressed? And right
Yeah.
there, they shut you down,
Hmm.
you
Yeah.
know.
And I think most women hide, honestly. I think with our background, most people hide. Um, that we hide it when we are frustrated or stressed,
Right.
because we don't know if we're really going to receive help. I personally think that people hide
Or you don't
behind
want to
feeling.
seem weak,
Oh, yes, you don't want to
you
seem
know?
weak. You don't want to be talked down on, or you don't want your feelings to be shut down. The
Right.
moment you mention it, what are you talking about, and things like that. So I
Hmm.
think that's why. But well, that's why we have the chat room and the rest. So go
Yeah.
ahead.
And so,
Yes.
somebody put in the comment, I want to read Clara's comment where she said people go through it and don't even know that they are experiencing it because they didn't even know what it is to begin with.
Yes.
You go through it and just, I remember like with my first child, um, I was with my mother, and but I was in a room with just me and the baby, but my mom was taking care of us. Um, but I just felt sad. I just, it was just, I don't know what it was, but in that moment, this is like 2011, before I became aware that there's even a thing
Those.
called postpartum depression. I was just like, I remember one time my husband called and I'm just crying, and he was like, "What's going on?" I don't know. I don't know. I need to leave the room. I need to, like, I'm confided in this room because I had a C-section and I can't do anything. I can, barely pick up my child. And, it was just a lot. And I didn't know that that was what I was experiencing because there wasn't really like a name to it, but I knew that I was
Right.
sad. and I needed to leave that space that I was in, you know.
Right.
So
and
yeah,
and
it
that's
happens.
one of the symptoms, increased tearfulness, you just crying out of nowhere, you just irritable, you don't even want anybody to talk to you, you don't want to eat, or you might eat a lot, you don't want to sleep. And again, most of women don't come forward because you feel guilty for feeling even sad. What do you mean you're sad? You just had a baby. Look how
Yeah, you
beautiful
should be
this baby
happy.
is. Like, are
It's
you
a
not
joyous
grateful to
moment.
God? Some women are praying for kids, and you have one and you are depressed. So that you shut up and you just endure all of this. And I watched a movie that I will never forget, traumatized me, where a lady had a baby and she drowned her baby. She
Hmm.
drowned her baby
Yeah.
because the baby won't stop crying. She's been going through this postpartum depression for so long, and she didn't know what else to do, and she was so frustrated, and she got to her breaking point.
And
Yes.
only God knows how bad she really desired that child.
Yes.
Mm,
Yes. Like,
yeah.
they make us feel guilty, and some people, I don't even say they, we make
So let
ourselves
me
feel
ask let me
guilty.
ask you this, Miss Linda. What advice would you
Yes.
give to the husbands? The
The
husbands that
husbands.
when the wives have babies and they don't think, hey, it's just a baby.
Yeah, so the husbands need to be aware, and not to minimize ours, but the husbands also sometimes might be going through that same depression.
Well,
um
the husbands don't. I
My
mean,
depression is more than your depression. I just gave
yes,
birth.
no, because look, like waking up in the middle of the night, if you are
Hell,
breastfeeding, I mean, oh, but
so
we
the
have to
lack of
you know,
support. Yes,
some of
the
them,
lack of
whilst
support.
the baby can wake up 3 times, maybe 4 times in the middle of the night. He's sleeping,
Yes.
snowing his way out, to
Yes,
heaven. Come
we need
on.
to make our husbands accountable. We need to be partners with our husbands. We don't need to be super women in our houses. It is
Thank
okay
you.
to ask for help. Please, I am begging you. You don't need to do it. So you can be like, oh, my wife, for dear, she's like, she does
She
everything.
got it. She's a
No,
superwoman. She can
She's
do
a
your
it all.
husband is
superwoman.
supposed to be your partner. You made those babies together. It wasn't just you. Without your husband, that baby wouldn't be there. So let's rotate. Okay. Yes,
Speak
we want
up.
to be like so understanding. Oh, wakwa ejuma wa bre, and so I just no. You're also tired. And if you don't get the help, husbands, please help your wives, is what I'm saying. You might also be going through your own stuff, but at that time, it's not just even the physical. I'm just going to talk about some of the hormonal changes that we go through physiologically when you have a baby. It is
Mm.
not just the baby just came and that's it. Your prolactin level goes really, really up high, right? And then you also have your progesterone, which is going down low. Progesterone is the hormone that is a calming hormone for us. It's an anti-effective hormone that makes us calm down. So once you have the baby, the body brings down that progesterone level. And if that happens, you can be restless. There is sleep problems. And then also that's mood instability, up and down, up and down. And that's not anything that the woman has any control over. It's only because they had a baby. I mean, think about it. We brought a whole human being into this world. Okay. And then also your oxytocin also goes up high, especially if you are breastfeeding. Oxytocin makes you feel good. That helps you bond with your baby, right? But then again, all these hormones are doing, they are doing some seesaw stuff
Yeah,
in your body. Your body is confused. So one day you're very happy, the next moment you are
you're
sad.
crying.
Oh, and then
And that
also your
happens.
cortisol. It happens. There is a scientific reason behind this. So it's not just like, oh, you're just tired or whatever, or you just don't want to do it. Your body is actually going through these things because of all these hormonal changes. Your prolactin level goes up high. Your cortisol level, which is the stress hormone, also fluctuates. It goes up and down, up and down, up and down. Your thyroid hormones also may change. If your thyroid hormones are off, Some patients will come and they are very, really anxious, and it has nothing to do with their mental capability or whatever. It's only because their thyroid hormones are off whack. We do labs, we give them, thyroid stimulating hormones if their thyroid level is low, and all of a sudden they are okay. If your thyroid level is really high, you are very anxious. You are like somebody who is about to just like have like a heart attack. If
Mm,
anybody has gone through panic
mm,
attack, it feels like a heart attack.
uh,
Many patients have come to the emergency room thinking that they are having an MI, your myocardial infarction, or they are having a heart attack because nakuma shishino, nakuma yeneya, and it's because of panic attack. So if
mm,
your thyroid hormones are also off, you can be very, very irritable, or you can be very, very, very low, which is very depressed. So again, aside from the lack of sleep, aside from the lack of support, your body is also doing some things on its own that you have no control over. So again, husbands, please be mindful and be intentional. Okay. How about if you're breastfeeding, pump some of the breast, save it for the night so you can alternate. Baby wakes up 1 minute, you breastfeed. If the baby wakes up again after you breastfed, husband use the bottle and give the bottle to the baby. There is nothing wrong with that.
mhm. Yeah.
Uh,
Let me I touch on that. I remember when I this first baby, your first baby is your experimental baby. That's when you're learning, you're learning everything. I was home, my husband is working. So of course I'm gonna be the superwoman. He's going to work. So if I'm home, I'm with the child, at night, I'm the one that's staying up with him to feed him, to, you know, do all the work, And then I was not directly breastfeeding. So if he eats, then I have to spend time to pump, so he will have milk. And then I'm doing the bottles. I'm doing this. I'm cooking. I'm
mm,
cleaning. It got to a point, when my husband come home, I'm just like, I look at him like I'm almost angry.
You are
No,
angry.
he's done nothing. Me, I'm home doing my thing. He's done nothing. It got to, I had to literally say, he will come, and I hadn't communicated, right? So he will come home, and of course, food will be ready. He will sit down, he will eat, and then he will sit down in front of the TV or on his phone while I'm still like, doing everything. And I became very irritated, right? But I had to
Mhm.
advise myself to say, have you even told him that you need help? I hadn't. I hadn't. So I told him, I said, please, when you come home, at least if you can even just wash the bottles, because we were using one of those Dr. Brown bottles, and I hate those bottles because
Mm.
you have to, like, it's so much work to
All
clean
those
them.
parts and
Yes, all those parts, so it was a lot. Imagine like going through the whole day not washing anything and it's all piled up, and you come and you're like in front of the TV, like I've been home, so I should be continue, I should continue to do all that. So I had to literally open my mouth to say, please, when you come home, even if you can wash the bottles, it will help. And he
yeah.
did it.
Yes.
It just took me having to like communicate,
Yeah.
So as time went on, I'm like, okay, I'll ask him to do this. I'll ask him to help here. I'll do this. And then it got to a point that he could take paternity leave. So when he was on paternity leave, then again, I was not directly breastfeeding. So he had the opportunity to stay up at night, feed the child, and then I can pump. So then we can at least like, I can get a little bit of rest, and
Yeah.
in the daytime, he can
Mm.
also get some rest. But it took me having to communicate, because can you imagine if I didn't even say anything, and then I'm expecting him to just mentally read my mind and know what I'm expecting, and then if he doesn't do it, then I'm irritated, and now I'm
Right.
picking fights with him, and he doesn't even know what he's done, and next thing you know, our marriage is ruined because I couldn't
Right.
really communicate how I was feeling. So
Yep.
sometimes it's on ourselves. Let them know what you need help with.
Yeah,
Don't
it's
do
true.
everything. Don't think you can do everything by yourself. You cannot.
No.
It's a
No.
lot. You cannot do it by
Nope.
yourself. So ask for help.
Ask for help.
Yes. Yep. And communication is a big thing, right? We sometimes be like, if it was me, I would have known this is what I should do. Do I need to tell you, are you a child?
Yeah,
No,
you have
please. You have to open your mouth and say, I need help. Hey, can you
to.
do this for me? Hey, can you do that for me? Communication is very key in everything that we are talking about today, with the stress, with the depression, with the help. Don't assume that they can read your mind or they can read the need in the room and so they should just get up and do it. uh yeah, no.
Yeah. Miss Linda, one
Yes.
second. Well, again, if you're just tuning into the chat room, thank you for tuning in. Here is a platform dedicated to resolving daily life issue. I have myself, Lady Mary Boydu, and my co-host Nanaya Sapon with our next practitioner. She's a psych nurse practitioner right here in New York City with us. It's been an amazing discussion. If you believe that it's been a blessing to you, please just click on the link and share. But please, let's take a quick second break. And when we come back, she will go on to the next few slides she had so that we can bring our session to an end. Stay tuned.
Yo, yo, yo. Now your matter with the talk. Your life, your wahala, your breakthrough, idea. Welcome to the chat room.
This no be ordinary place. Now a solution they show face. Lady Mary they lead the way. With guess where go blow your brain. Talk your matter make we solve 'em. No judgment, just love and wisdom. We they discuss, we they learn. Every episode you gon' feel the burn. Oh, the chat room. Now here we they find a way. Oh, the chat room.
Oh, yes.
We go talk and clear, no delay.
No delay.
Oh, it's interactive, educative, informative, and unapologetic. Oh, the chat room. We unstoppable, no be lie. You, hey, the chat room. Hey, now here we can find a way. The chat room. We go talk and clear, no delay. No delay.
Unmute yourself.
Okay, it would be better if I could unmute it. Can you hear me now? Okay.
Yes.
Auntie Nana, thank you so much for joining us. We miss you here in the chat room. I'm hoping you can come to the chat room next month. Please greet all the people in the United Kingdom for us. We miss you. Clara, thank you for tuning in. Mr. Kwabna Sapon, thank you. Is it Mosquette or Mosquite? Thank you for tuning in. And Eunice, thank you for tuning in. We appreciate you all. Lorenzo the Great, thank you for always making time. Apia Kubi, thank you for joining us. We are grateful. AJ is watching on YouTube. Thank you for tuning in. And Miss Linda, we appreciate you for giving us your time. But please go ahead and take over.
Okay, so I wanted to just go over a few more slides and we are going to be all set. But when do you seek help? When do you say, I need help? When do you go for the professional help? When your symptoms have lasted more than 2 weeks, if you feel like the symptoms are getting worse, the anxiety, the irritability, the tearfulness, and the sadness, if you feel like you're unable to care for yourself or your baby, you need to seek help immediately. And like Nana said, if you're having any thoughts of self-harm or harming your baby, if those thoughts, if it's even if it's fleeting, please seek help. You have to seek immediate help. There is a hotline, 988. That's a suicide hotline. And we also have the 911. You can call them, let them know that you don't feel safe. And also in your local districts, they have lines that are dedicated to women going through postpartum depression. If you go on Google and you type in postpartum depression resources in your area, they will tell you. You'll be surprised. It might be a mile away from you or a call away. Yes. Okay. So if you don't remember anything, 988 is a suicide hotline, and the areas that you are have resources that is specific for women going through postpartum depression. These supports are normally 24/7. So, if in the middle of the night when everybody else is sleeping and you're not able to fall asleep and your mind is telling you, why don't you just drown this baby? Why don't you just end all of this? Like, this is going to be your life. Um, in the normal circumstances, if a patient come to me and they say, I've been feeling suicidal, I'll ask you, do you have a plan or intent? Right? What is your plan? Well, how are you planning on doing that? And do you intend on carrying out that plan? And if it's yes to that, it's an emergency situation. But for a postpartum mother, I'm not even going to ask if you have a plan or an intent. If it's fleeting, even if it's like, what if I just lay down and I don't wake up? I'll be happy about that. That's passive death wish. And that is dangerous. Please seek immediate help. And again, if you have a sister or a brother or someone that you trust that is in your corner, that's the time that you call those people. That's the time that you scream for help. And if we are one of those people that the person comes to, please let us know what we can do to help them. They need to seek immediate professional help if they are suicidal. We will pray with them. We will stay on the phone with them, and we will call that 988 number immediately. Okay. Stress management. How can we manage our stress? There are very, very simple things that we can do. We have the immediate relief stress, and we have the long term, techniques that we can use to alleviate our stress. The easiest and most available to you is controlling your breathing. Slow deep breathing. In and out. In and out. You breathe in all the positive energy. You blow out all the negative energy, all that tension. Do you realize that when you're stressed, you might not even know it, but your shoulders sound like this? You are very tensed. Again, if you remember, is the body's natural way of saying that there's danger. So prepare yourself. Flight or fight motion. So remember, if you're feeling stressed, relax your shoulders consciously. Be mindful of your body and say, breathe in the roses, blow out your candle. And if you do that a couple of times, you will see that your body will naturally start to relax. Okay. There is something that I also tell my patients. Okay. Identify 5 things that you can see. Identify 4 things that you can hear in your surroundings. When we are stressed and in a period when we are having a panic attack, we feel like the world is coming to an end. It's not real. The walls are closing in on you. If you are able to identify 5 things that you see, it will take your mind off that anxiety that you're having right there, that panic attack that you're having, for you to be able to identify that 5 thing. I see a bottle, I see a picture on the wall. What do you hear? I hear the radio, I hear a car passing by. That is a form of distraction to distract you from you going into a full-blown panic attack. Okay. Taking a walk. If you have a baby, take the baby out, put them in a crib. If there's somebody in the house, please take care of the baby for me for 5 minutes. Just go outside your door and walk outside. Feel that fresh air. Walking actually, releases endorphins. Endorphins are good, feel good neurotransmitters and hormones that you get from just walking. Get in some breath of fresh air. Okay, get some sleep. Like we said, ask your husband to help you. Even if you get an extra hour of sleep, you wake up feeling like a superhuman. I will attest to that. The first time I had my baby, my first time I had Carly, and I remember this. My then husband came home and I was like, I'm just gonna go to the grocery store. I didn't have anything to buy. I just wanted to get out of the house. And it was the best feeling I had. I went to the grocery store, but it was like such a relief, you know, take a step out, you know, let them take care of the baby. Sometimes some women are actually like so anxious to leave their child with their own husband. Oh, on
They
to
will
me,
not
Shano.
say.
Debbie,
They will
Debbie,
not.
only my corner. The diaper going to me, Susanna. Please, if they don't know how to change the diaper, teach them,
It
or
must be
let
a
them
first
figure it out
baby.
themselves. Okay, we don't need to be super humans. A husband are not going to love us less because we ask for help. So please be trustful of your husband that they will take care of the baby. It's not only you that can take care of your baby. And yes, you want it perfect, but at this point, let them also help you. All right. So taking that
That's
step
nice.
back and getting some sleep is also very, very important.
And that
Anybody
is
have a
not
question?
it's and that's not just your baby anyways. It's
It's
it's our
everything.
baby. It's both of your so
If
Like
you
I
can't
said,
trust the person you made the
I
baby
didn't
with to
make it
take care of
myself.
them.
yeah. So
You know, it
thank
wasn't.
you.
It was two people that lay down, and it
Yes,
became four
trust me.
legs, and the four
Yes,
legs produce a baby. So please,
exactly.
don't take all that burden on yourself. I'm begging you.
Yeah.
Um,
Yeah.
sleep is something that we take for granted, and sometimes we overlook. But sleep is very, 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 very important for yourself, for your baby, for your kids that are older, for anybody that you know.
Hmm.
I had a presentation and my older sister had jumped in and she was talking about how, you know, her husband will go in and check on the kids when they are sleeping. And sometimes when they see that one of the kid is not sleeping and it becomes something that happens over a time, they realize that they are going through some stress. So even making sure our kids are sleeping, if they are not sleeping, there might be something going on.
Yeah.
All right. So sleeping is very important. If you're not getting enough sleep, you are not thinking straight. Somebody who is not getting enough sleep is like someone who is drunk. So like they say like if you're driving sleepy, it's like you are driving under the influence of alcohol.
Yeah.
Sleep deprivation can actually make you psychotic. You
Mm.
will start hallucinating. You
Mm.
start seeing things. So please don't let us minimize the importance of sleep. Get enough sleep, get enough hydration, and pray.
Amen.
That's also very important.
Yeah.
Develop a sleep hygiene. What do I mean by that? What time do you go to bed? If that time that you're going to bed, if it's 9, if it's 10, whatever it is, you have to develop a habit of not picking up your phone or your tablet or your screen and being on the internet. That blue light in your eyes is going to keep you awake. Even when you are sleeping, you feel like your mind is racing. Your mind is active even when you are sleeping. What is it that makes your body calm down? Is it you taking a shower? Then please do take a shower. Some patients, I tell them warm milk is very, very good for sleep. You
Mm.
warm your milk if you're not lactose intolerant, like some of us, a warm milk, drink that before you go to bed. You lay down, you are going to fall asleep. I and my youngest daughter, we like some form of white noise. I realized that the sound of rain it calms my body down to sleep. So if I feel like my mind is very active and I'm trying to sleep and I can't, I turn it on my phone and I go to sleep. Find what works for your body and please don't minimize your sleep. Even if you're getting like 5 to 6 hours at our age, 5 to 6 hours is more than enough. If you can get more, that's great. Okay. Please let me know if you have any questions.
And
So
for me,
yes.
I find that exercising helps a lot.
Yes.
Like if I feel anxious, my mind just can't rest and I'm just kind of like all over, if I'm able to
Mhm.
like get some exercise in straight away, I'm refreshed.
Yes. Because don't forget, exercise releases that endorphin,
Hmm.
right? Your muscle also gets tired. You do that exercise. Try not to do it an hour before you sleep because it will actually also will stimulate you to stay awake.
Yeah.
But exercising will release that endorphin that makes you feel good. I mean, I don't know, like I love to walk, especially in the spring and in the summer. And once I'm done, like the way I feel good, it's amazing. All right. And so exercise is also very good. Your social network, like I mentioned a few minutes ago, having someone that you connect with, having someone that will not judge you, that you can talk to, that will pray with you, that will walk with you. Get dressed and go out. Have fun. Okay. That will make you also feel good. Um, and I think that's about it. Unless anybody has any questions for me. Um, Lady Mary, if you don't mind putting it down to the last slide for my QR code. Like I said, I just opened up a private practice. So those of you who are in New York and you can scan this, anybody can scan this actually. If you scan it, it will take you to my official page that I have for my practice is Linda Japon, nurse practitioner in psychiatry. I have an office and I also do telehealth. I take care of kids as young as 5 to 6 years old and as old as they are alive, going through any mental health issues. I do medication management, so I prescribe meds and I do a bit of psychotherapy. But thank you, Lady Mary, so much and your husband for extending this invitation. I love to be able to talk to my fellow women and also learn some things from each and one of us. So thank you for inviting me to this, and I appreciate the opportunity.
On mute.
You are so welcome. You are welcome. Thank you for honoring our invitation as well. Like we said, this month is mental health awareness, but we are looking at all things women. So please don't forget to tune in every Sunday. If you're new here, we thank you for choosing to spend this 2 hours of your time with us. We appreciate almost 2 hours. We appreciate your
An
time.
hour and a half.
Yes, an hour and a half. And we hope that you will stick around with us. It's informative, educative, and informative as well. I have Nanaya is the co-host for the chat room, and tonight we have Miss Linda Ejapo all the way from New York. Thank you so much, Miss Linda. We appreciate you for coming. But my takeaway is don't act or don't try to be a superwoman. Ask for help when you need it. Your husband or your spouses are not soothsayers. So don't just think. Don't live in the old way of which our parents lived and think, okay, you know what? I can make it myself, but then you are inwardly struggling. Seek for help when you need one. And then have yourself a quality village. If that means two friends or three friends or one, at least somebody you can go to. This morning, interestingly, the thoughts came to me as I was having my shower this morning. I don't know why, but I thought about, so what would happen, let's say if my husband is not around, and if my husband is not here, how would people know, right? But I was thinking of my circle and I'm like, who would actually call me, who calls me or texts me to check on me? I was thinking about that, and thankfully I have a lot of people. Okay, I posted on my WhatsApp, I think somewhere last year, and I said I needed people to send me $50. And then Nanaya texted me and said, I don't even believe what you posted, and I don't even remember. She said, I don't know, I don't believe what you've posted because I know that if you truly need $50, you know where to go to. And truly, truly, yes, if I did. But I did that. I was trying to see the response that I would get, not because I needed the money, But the fact that and she wasn't the only person that responded, but the fact that people responded to say, we know you are joking, that tells me, So please have quality of friends, have people around you. And don't be in that mindset of, oh, if I tell her my story, she's going to tell this person. And so what? If I tell you my story and I get solution, whomever you choose to tell, that's your business. So that's my takeaway for tonight. Nanaya, any last words before we jump off?
I think you've said it all. I just focus on, seek help. It's not weakness. It's not unchristian like. God has given us all resources, and in wisdom, use the resource that's available to you. Use everything that God has made available. God is not going to come from heaven to come help you with anything. Most of the time, he's using people.
To give you that $50.
Yes, he's using people. So if you refuse to use your resource, then you can blame God. It's kind of like that guy, the story about the guy that was drowning, and different people came to try to save him, and he said no, he was waiting for a miracle, or he's waiting for God to make something happen. He's waiting. And then he drowned. And then he got to heaven, and, he was upset. Why did you let me die? Why didn't you help me? And God said, I sent so many people to come and help you. You refused to help.
Yeah.
You refuse to help. So, we only have ourselves to hold accountable, but there are resources out there. Yeah. So, when you know better, you do better.
Thank you so much, everyone. May we all have a good night. We'll see you next Sunday. Thank you so much. Have a good night, guys. Bye.
Good night.
Good night.
Yo, your matter with the talk. Your life, your wahala, your breakthrough, idea. Welcome to the chat room.
This no be ordinary place. Now a solution, they show face. Lady Mary, they lead the way. With guess where go blow your brain. Talk your matter, make we solve them. No judgment, just love and wisdom. We did discuss, we did learn. Every episode you gon' feel the burn. Oh, the chat room. Now here we define the way. Oh, the chat room.
Oh, yes.
We go talk and clear, no delay. Oh, it's interactive, educative, informative, and unapologetic. Oh, the chat room.